I think a new settlement for health and social care is needed, and I think it's been long trailed by a number of reports over the years, and certainly the current debate with the Oldham report out as well is making it look as if everybody is in this territory. Exactly what that should be is really, really difficult, and I think everyone knows what the issues are. They're well rehearsed, but the solutions, as we can see in the report, which I think bravely enters into the solutions territory, are not easy. I think that the report proposes that we bring together health and social care into a single settlement and for single commissioning. And I think in principle that seems like the right thing to do. Some important points were raised today during the launch about the fact that not everybody is receiving joined up services all the time, so we need to be careful that I suppose we don't use a sledgehammer to crack a nut. But I do think that if you're the person, the care or support or health support that you need should be around you, and you shouldn't be worrying about whether it's health or social care. And I suppose in a way I think that extends to charging as well. You know, we should define what's charged for, less by whether it's a health or social care service and more by some other criteria about perhaps the extent to which you need it, or the extent to which it's essential, or the extent to which you can afford to pay for it, of course. For the report to stand a chance when it comes out in its full version later in the year of really triggering some action, I think we've really got to make a compelling case for what would be different, what would be better, and why should we tackle these difficult questions, and what will happen if we don't, I suppose. I do think that particularly in social care there is such a funding shortfall at the moment, and because the demand continues to rise and the funding continues to fall, when that starts to impact on the health service, maybe there's more chance that people pay it more attention. I think that's kind of where we are now. The fact that maybe acute hospitals are being affected by the fact that social care is limited in some areas is making people pay a bit more attention to the thing which is probably the glue in the system. And I think it was really interesting to hear today Camilla Cavendish's view about the innovation in social care and not losing it. So I think there's another really important point about the how. So if we go for this settlement, we go for a single solution, how do we not lose the good in both bits of the system?